Electromyographic Biofeedback. The content within this lecture can be found within Chapter 18 in the Therapeutic Modalities text by Chad Starkey and is mentioned on page 8 and 9 in the Therapeutic Modalities, the Art and Science text by Kenneth Knight and David Draper. Biofeedback is the process of detecting physiological activity in the body and then converting that activity into a visual and/or audio cue that the patient can use to modify movement. It really means getting information about your physiological responses and using that information to take action. For example, when you take your temperature and find out you have a fever, you might call the doctor. Another example would be in using electromyographic or EMG feedback. The unit amplifies the body's neuromuscular electrical activity and converts it to an auditory or visual signal. The patient can then use this information to help modify their activity, such as increasing muscular contraction of specific muscles. This type of treatment can be used with a patient who has had surgery or an injury and forgets how to activate certain muscles. Biofeedback is commonly used. Biofeedback measures at least one of the 5 biophysiological properties. The resulting feedback can be used to re-educate muscles, facilitate muscular relaxation, to control blood pressure and heart rate, and to decrease the physical signs of emotional stress. Some common physical signs of emotional stress include apathy, which is a lack of interest, enthusiasm, or concern, lack of energy, difficulty making decisions, difficulty keeping track of things, feeling on edge, a change in an eating habit, sleeping more than usual or difficulty getting to sleep, being more emotional, and using alcohol or drugs to relieve or forget stress. It is important to understand that biofeedback does not monitor the actual response itself, for example, the strength of a contraction. Rather, it measures the conditions associated with that response. A real-life example of biofeedback treatment can be seen at Iowa State University within their counseling center. The purpose of the feedback is to help students to decrease the physical signs of emotional stress. During a biofeedback session, the room is quiet and darkened. The students are sitting in recliners, and the students wear noise-canceling headphones and fingertip sensors, which measure skin conductance and the heart rate. 3 choices of computer software offer a variety of self-guided, interactive programs for the students. As students practice the relaxation techniques presented, they can watch real-time graphs of their physiological responses. This information helps them identify the activities that work best for them. Once mastered, they can use the techniques whenever needed, before taking a test or giving a class presentation, for example. Sessions can last from 15 minutes to an hour or more. As has been mentioned, electromyographic or EMG biofeedback is extremely common among therapy clinics as well as in research studies. There are 2 forms of EMG biofeedback, either invasive or superficial. Invasive EMG biofeedback involves inserting a needle with a feedback wire into the muscle. The needle is typically hollow and is used to insert the biofeedback wire. The needle will then be removed with the biofeedback wire still implanted inside the muscle during activity. Invasive EMG biofeedback is most commonly used for diagnostic and research purposes rather than within the clinical setting. Superficial EMG biofeedback involves the application of electrodes to the skin to collect muscle signal. While it's nice that a needle is not needed for treatment purposes, there are some drawbacks to superficial EMG biofeedback. There is a possibility of receiving a signal from a neighboring muscle, a condition called crosstalk, that may be identified by the biofeedback lead. The possibility of collecting signals from a neighboring muscle may mislead the clinician or the patient into thinking they are getting a result when there may not be one. Superficial EMG feedback is most commonly used in a clinical setting. The signal received from a biofeedback unit tracking muscular contractions will look something like what you see on your screen. There is a baseline But as more motor units are recruited, the signal on the screen becomes more intense, as is displayed on the right side of the screen. The application of EMG biofeedback involves the use of 3 electrodes positioned over the target muscle or muscle group. Basic EMG biofeedbacks have one channel composed of 3 surface electrodes that are combined on a single self-adhesive electrode. 2 of these electrodes are active electrodes, which means they measure the amount of electrical activity within the muscle. One of these electrodes is considered a reference electrode and is used to filter out non-meaningful electrical activity. The electrodes monitor the electrical activity within a local area of a muscle, usually the muscle belly. Biofeedback is most often incorporated into the orthopedic treatment program following surgery or long-term immobilization. Biofeedback can be used to increase or decrease a muscle contraction. The treatments are often incorporated into orthopedic treatment and rehab, for example, to track the muscular activation of the vastus medialis oblique, or VMO, which is the muscle that's circled in blue on the slide. The VMO can become inactive in a patient with ACL reconstruction. This feedback can be used with E-stim to help create a muscle contraction, or we can also use verbal or even visual feedback to reinforce the re-education with biofeedback. When we're teaching a patient how to use biofeedback, we're going to have to help them facilitate the muscle contraction. To do this, we need to give our patient specific instructions. First, have the patient contract the muscle on the opposite limb, then the involved side. Then apply the biofeedback unit to the opposing limb first. Have the patient watch and/or touch the contracting muscle so they can see and feel what that muscle feels like while it's contracting. We can also then progress to having the patient contract surrounding or the opposite muscle. Next, we would have the patient contract the proximal portion of the muscle or muscle groups to help facilitate the distal motor units. We could also use E-stim to evoke a muscle contraction, which would help the patient to visualize what the contraction should look and feel like. The contraindications associated with biofeedback include unhealed tendon grafts, avulsed tendons, second and third degree strains, injuries to joint structures, and unstable fractures. So pretty much any time joint movement or isometric contractions are contraindicated. Biofeedback is being utilized in a lot of different capacities. There is one engineering school that has utilized biofeedback within the muscles of the forearm to act as the controller for the Super Mario Bros. Game. This would be a really unique way to play a video game, wouldn't it? There are other commercially available products on the market, including monitored rehabilitation systems. This program uses a pressurized board to help provide the patient with biofeedback for different movements, including functional squats, cable columns, back extension, horizontal row, leg extension, and several other exercises.